For many seniors, especially women over 60, the danger of a heart attack is not always obvious. The problem is that the heart does not always cry out with severe chest pain. Instead, it whispers through unusual fatigue, sudden dizziness, or discomfort that feels like simple indigestion. These signals are so easy to dismiss that countless elderly women ignore them, only to discover too late that they were early heart attack symptoms. And when those signs are missed, the risk of a second, more severe heart attack or even a stroke increase. The solution is simple but powerful. Awareness. By paying attention to the unique ways women experience heart attack symptoms, seniors and their families can act quickly and protect their heart health. Recognizing that women's bodies may send quieter, less typical signals allows you to respond before permanent damage occurs. And the evidence is clear. Doctors who specialize in senior health have documented case after case of women who came in with nothing more than tiredness, jaw pain, or shortness of breath. Many were shocked to learn they were in the middle of a silent heart attack. Research confirms that older women are far more likely to experience these subtle warnings than men. When seniors recognize them early and seek medical help, survival rates rise, recovery is stronger, and lives are saved. Sign 1. A heavy pressure in the chest, not sharp pain. A common misunderstanding is that a heart attack always begins with severe chest pain. This may be true for men, but for women, the first sign is often a heavy, pressing feeling in the center of the chest, not sharp pain. Many describe it as if someone were sitting on their chest or squeezing tightly. Some think it is heartburn, reflux, or just vague discomfort, so it is easy to ignore. In reality, the heart does not always send clear signals like the skin or muscles. When it lacks blood, it can cause a dull, pressing, burning sensation deep inside. For middle-aged and older women, especially if there is high blood pressure, diabetes, or high cholesterol, even mild chest tightness is a serious warning. If it lasts a few minutes and comes with fatigue, nausea, or shortness of breath, it may be a sign of an ongoing heart attack. I once met a woman in her 50s who felt only a little chest pressure after carrying bags. No pain, no shortness of breath. But a timely check found she was having a heart attack without knowing it. So, if you have ever felt your chest being pressed or squeezed, do not be careless. Get a heart check early. One small action can save a lifetime. Have you ever felt this way? Share below. I read every comment, and if you thought shortness of breath with light activity was just aging, wait to see what is really happening in the next sign. Sign 2. Shortness of breath. During light activity. If you feel out of breath or winded while doing things that used to be normal, like walking, climbing stairs, or carrying light items, that is not a normal sign of aging. When the heart is low on blood due to coronary blockage, the body falls into low oxygen. The heart must work harder, and the lungs try to compensate by increasing your breathing rate. The result is shortness of breath, even without heavy effort. This is one of the earliest and most common symptoms of a heart attack in women, especially women over 50 with conditions like high blood pressure, diabetes, or high cholesterol. Unfortunately, most people think it is fatigue, the weather, or simply getting weaker. I once met a woman in her 60s who felt only mild breathlessness when walking around the house, but it turned out to be a heart attack. Fortunately, she went in early and received timely treatment. If shortness of breath appears suddenly or worsens over a few days, do not underestimate it. It may be the heart's first warning, and if not detected in time, heart attack and stroke can come unexpectedly. Have you felt unusual breathlessness even during light activity? Share in the comments because you might help warn someone else. If you have ever felt shortness of breath during light movement, even once, write down when it happened and get an early heart check. A simple test today can help you avoid a serious event in the future. Next is a sign people often think is just low blood pressure, but it is actually a clear warning from your circulation. Sign 3. Dizziness, lightheadedness, or feeling faint. No one wants to suddenly feel dizzy or faint, especially when just standing up, walking lightly, or getting out of bed in the morning. For many women, this can be the first sign of a heart attack. Do not take it lightly. When the heart does not pump enough blood to the brain because of blockage or rhythm problems, you can feel unsteady, have blurred vision, or feel faint because the brain is briefly low on oxygen. Many mistake this for low blood pressure, lack of sleep, or being tired. But if it happens suddenly, without a clear reason, or comes with fatigue and shortness of breath, be alert. I once met a healthy woman near 50 who felt dizzy while cooking. No chest pain, no heavy breathing. But an electrocardiogram showed she was having a mild heart attack. If delayed, the outcome could have been serious. Dizziness may seem minor, but it can be a sign of low brain blood flow from a heart attack. In some cases, it is the stage right before the heart stops. Have you ever felt dizzy when standing up? Has it happened again recently? Share, because what you overlook could be a major warning. If dizziness repeats, do not ignore it. Spend 15 minutes on a heart check. It may help you avoid a heart attack or stroke later. And you may not believe the next sign is so simple that almost everyone has had it. That simplicity is why thousands of women miss their chance to survive. Sign 4. Unusual sweating. No one thinks sweating is related to a heart attack. Women often assume sweat comes from hot weather, stress, anxiety, or simple hormonal change. But unusual sweating is one of the classic signs of a heart attack, especially in women. When the heart is short on blood, the body activates the sympathetic nervous system like the fight or flight response. The result is a faster heart rate, blood pressure changes, and sweating, often cold sweat without exertion. If you find yourself sweating more than usual while doing light tasks or even while sitting still, especially when it comes with fatigue, chest heaviness, nausea, or dizziness, that is not normal. I once met a woman over 55 who came in for a simple reason. She said, "I soaked my shirt with sweat while sitting at my desk, even with the air conditioner on." She had no chest pain, no shortness of breath, no dizziness, but her electrocardiogram showed silent ischemia. We moved her to the cath center and prevented a serious heart attack. The problem is that many women never think sweat is connected to the heart. Because of that, they miss the golden time to intervene. Have you ever broken into a cold sweat while just sitting or doing light work? Do you think it was an inner warning or just fatigue and stress? Next time it happens, do not skip it. Note the time and any other feelings, and if it repeats, go for a heart check. That small step can reveal silent problems before it is too late. In reality, there's a type of pain that is easy to overlook, especially in women, yet it is a typical sign of a heart attack. No chest pain, no shortness of breath, just pain in the shoulder or arm. You need to know how to spot it. Sign 5. Pain in the shoulder, arm, or back. Many people think a heart attack must cause chest pain. In fact, many women do not have any chest pain, but instead have vague pain in the shoulder, the arm, or even the back. This pain can be dull or occasionally sharp. It often appears in the right shoulder, the right arm, or the mid-back, places easily mistaken for muscle or joint pain, or from heavy work. Because it is not typical, it is easy to ignore. When the heart is low on blood, the pain is not always centered in the chest. In women, pain signals can spread to other areas, especially the shoulder, arm, or back, because the heart's nerve network is wide and complex. This is why many people are careless. I once met a woman in her 70s who came in only for right shoulder pain after cleaning the house. No shortness of breath, no chest pain, no dizziness. The shoulder X-ray was normal. But because something felt off, we did an electrocardiogram and found she was having a heart attack. Thankfully, it was treated in time. The problem is that without timely detection, she could have been sent home with pain pills, and a serious event could have followed within hours. I have seen this more than once. So ask yourself, Are your recent shoulder or back pains really just from overwork or aging? Have you ever felt pain without a clear reason that did not improve with rest, and then ignored it, thinking it would be better tomorrow? Listen to pain wisely. If you feel pain in the shoulder, arm, or back without a clear cause, pause and check whether it comes with shortness of breath, fatigue, or nausea. If it does, do not wait. See a cardiologist as soon as possible. Early detection can be the difference between life and loss. The next sign is even easier to ignore because it does not appear during the day. It happens while you are in bed. If you do not notice it, you might wake up in the emergency room. Yin, 6. Insomnia or poor sleep. Insomnia is something many women dismiss, especially after 50. Few people know it can be one of the earliest signals the heart sends before a heart attack. Not chest pain and not obvious shortness of breath. It is trouble falling asleep, shallow sleep, waking in the night, and waking up exhausted. This happens when the heart starts to work less efficiently, slightly upsetting the autonomic nervous system and affecting sleep quality. I once met a healthy woman who came only because she always woke up tired. No one thought of heart disease until an electrocardiogram found silent ischemia. What is notable is that small disturbances like this are usually ignored and only get attention when the heart attack has already happened. If your sleep has become worse along with unexplained fatigue, get a heart check. Do not wait for chest pain to start worrying. And you may be surprised. Some heart attacks begin with nausea, and many women think they just ate something bad. A few hours later, they are in the emergency room. Sign 7. Nausea, vomiting, or stomach pain. Nausea or stomach pain are familiar symptoms, which is why many women never connect them to the heart. In many women, heart attacks start not in the chest but in the upper abdomen. It can feel like bloating, nausea, or mild cramping, which is easy to mistake for digestive trouble, especially if there is vomiting. But if you are high risk, such as with diabetes, high blood pressure, or excess weight, that mistake can be very dangerous. I once saw a woman in her 60s who came in with non-stop vomiting after eating. She thought it was a stomach issue from old food, but heart tests showed an acute heart attack. The issue is that the stomach and the heart share a nerve network in the upper abdomen. When the heart is injured, the brain can misread the pain as coming from the stomach. So nausea in women needs careful evaluation, especially when it comes with fatigue, sweating, or mild chest discomfort. If you have unusual nausea or repeated vomiting without a clear cause, do not blame the food first. Let a doctor rule out heart causes before feeling safe. It is only the stomach. And there is another sign that seems harmless: fatigue, but not the kind after a busy day. This is unexplained exhaustion that many women feel right before the heart stops. Sign 8. Unusual fatigue. If you feel exhausted without doing anything hard, or a few small tasks make you want to lie down, this may be an early warning from the heart. In women, fatigue from low heart blood flow often has no clear cause, lasts for days, and does not improve with rest. It is different from fatigue from lack of sleep or overwork. I once met a patient who came only because of strange tiredness. No chest pain, no shortness of breath. But tests found silent ischemia. If your body signals persistent fatigue, get checked early. Do not wait for chest pain, because the final sign is often mistaken for a tooth problem, but it can be your heart's last warning. Sign 9. Pain in the neck or jaw. Many women come in with a dull jaw ache or neck discomfort and think it is dental pain, jaw strain, or a bad sleep position. Few expect it to be a heart attack. In women, the heart's nerves often spread pain to the neck, jaw, or ear. That is why heart pain may appear in these places instead of the chest. I once met a patient who only complained of left jaw pain and had no typical cardiac signs. but an electrocardiogram showed the early stage of a heart attack. The danger is simple. The less typical the sign, the easier it is to ignore. With neck or jaw symptoms, many women choose to see a dentist instead of checking the heart. If you have neck or jaw pain without a clear cause, not related to chewing, sleeping posture, or movement, get a heart check. Early caution can help you avoid tragic risk. These are 9 signs, none of which look like the classic male heart attack. That is exactly why women most often overlook them until it is too late. It is not always chest pain. Sometimes it is unusual fatigue, long-lasting poor sleep, light sweating, or pain in the shoulder, jaw, or neck. Small things that may be the first and only cry for help from your heart. What I want you to remember is this. Women are not weaker than men, but women's hearts are often quieter in danger. If we do not listen and pay attention, the price can be very high. Share this video with family, friends, and the women you love, because recognizing just one early sign can save a life. Thank you for watching this video. See you in the next one.